September 17, 2019.
Nugent 911, where's your emergency?
A call for help
We need an ambulance right away.
inside Cumberland Hospital.
We have somebody under respiratory distress.
Okay, breathing difficulty?
Yes.
One of the many things being scrutinized in this $25 million wrongful death lawsuit against the hospital, its owner, Universal Health Services, and former medical director, Dr. Daniel Davidow.
This is really a case about a young man who could not protect himself, and really a young man that could not speak for himself, whose mother entrusted a hospital, who said, we have the licensing, we have the skills, and we have the personnel that can absolutely take care of your child with special needs. And they did the opposite.
That young man inside this New Kent facility on the night of September 17, 2019, was 11-year-old Jeffrey Rodriguez.
Is he conscious?
No.
And in that moment,
Semi-conscious.
he'd have just hours to live. November 26, 2018, the first of two Cumberland admissions for the nonverbal self-injuring child who suffered from severe autism spectrum disorder, was referred to the facility from his Shenandoah Valley School District because of his need for one-on-one monitoring.
He would just drop and start hitting his head.
Last year, CBS 6 spoke to a nurse who cared for Jeffrey at Cumberland. She asked us not to identify her.
He needed to be a one-to-one, you know what I mean? You can't care for any other children while caring for him because it was so necessary for his safety.
But this complaint alleges that's not what Jeffrey received the majority of his 5 months here. It states multiple times the boy was placed in units that had, at best, a 7-to-1 staff-to-patient ratio. And although it was well documented in his chart that he was a danger to himself, the complaint states he was not required to wear his helmet around the clock, and self-harm was not always checked off in his records.
Jeffrey, who is the boy without the voice and could not protect himself, ends up in their hands and does not get one-on-one care like he should because he needs to be observed. You know, you need to prevent the head injury, not react to it.
The suit claims that the hospital and Davidow fraudulently misrepresented themselves, and Jeffrey should have never been admitted. The complaint also states the commissioner of Virginia's Department of Behavioral Health and Developmental Services notified Cumberland's CEO in February of 2020 that multiple units, including its autism unit, were operating child residential treatment program and inpatient psychiatric services without a license.
This was treated as a facility to house children, not to treat and care and protect for children.
How labored is the breathing?
Shallow.
17 days before this critical 911 call, another one was placed, and Jeffrey is flown to VCU after he collapsed and vomited. The weeks leading up to it would be documented. According to the complaint, on August 18th, he had 2 black eyes and edema.
His eyes were, kind of black eyes, and he was alluding to pain in his head, so we took off his helmet, and that was a terrifying scene. His head was so swollen. The indentions from the helmet were, it was, that immediately put me into tears. The second we took that helmet off, I was in tears, and I ran to call the supervisor, and I'm like, I need you now.
The lawsuit states Jeffrey sustained a significant bilateral paraorbital edema or swelling around the eyes and received no emergency treatment. A nurse practitioner requested additional imaging on August 20th, but the complaint points out Davidow signed the note on August 23rd and no imaging was done.
All of the different times where there are red flags, there are warning signs, there are things that should have been done better and could have immediately been done better that were either ignored chosen to just not deal with them at that time or hope that they would get better. But obviously for Jeffrey, these were dire consequences, these are dire situations, and they didn't react to it the way that they should have.
VCU calls in law enforcement and Child Protective Services after diagnosing Jeffrey with a brain injury on August 31st. And his VCU doctor notes Jeffrey's conflicting injury reports from Cumberland.
The only way Jeffrey, through his mom, was going to return to Cumberland Hospital after being at VCU was if Cumberland agreed to provide one-to-one round-the-clock supervision. They had him stable, but if that changed, if there was neurological change, he was to be returned to VCU.
According to the suit, Davidow did not indicate one-on-one supervision when Jeffrey returned to Cumberland September 6, 2019, while his case was being investigated by CPS, despite that being documented in his discharge summary. On September 12th, the complaint shows that Jeffrey was at one point unresponsive and showing signs of a neurological event and potential brain damage. The next day, Dr. Davidow notes that Jeffrey had a seizure during the night. The complaint says, quote, Davidow did not take any measures to get Jeffrey a higher level of care or return him to VCU.
Okay, turning blue. Where?
He wouldn't return
Body.
until it was too late.
Okay, lips turning blue.
Imaging at VCU confirmed significant worsening of Jeffrey's condition. Jeffrey was brain dead. He died just before 11:30 September 17, 2019, 4 days before his 12th birthday.
This family, you know, they want accountability, but they also don't want it to happen to any other Jeffrey.
We reached out to all the defendants in this case. They were unable to comment due to pending litigation. We asked the governor's office for comment on the recent allegations. Secretary of Health Dan Carey said, quote, the health of Virginians is our top priority, and our agencies have been working to ensure the safety of these patients for quite some time. More from those agencies on WTVR.com. Working for you, Laura French, CBS 6 News.